Okay, well, welcome to our next class. Good morning, everyone. How are you? So we are going to continue our presentation. We are presenting on looking at other factors that contribute the progression, or the factors that influence the progression of HIV into AIDS. What are some of the factors or contributing factors that help or that encourage HIV to progress to reach a stage whereby it's a disease called AIDS? So our first presentation. Make sure we are very attentive, because at the end of the presentation we are going to ask questions, make some comments after each and every presentation. You may start.
Good morning, my fellow students. My name is Sam Muhango, and I am here to present on the factors that contribute to the progression of HIV to AIDS. So, as you already know, HIV and AIDS are two different things. HIV, it is a virus that causes AIDS. So AIDS as a disease, it is a multiple of diseases occurring at the same time, weakening the immune body system of that particular person. So the factors I am to present are those that contribute to the progression of HIV to AIDS. So there are some factors, we call them non-treatment factors. Non-treatment factors such as age of a person, as my friends, I think it was Owen already presented on these ones. Non-treatment factors with age, sex, race, and intravenous drug users. Those guys that use injections they take drug by using injections. We call them IDUs, intravenous drug users. These non-treatment factors can influence the rate of progression of HIV to AIDS. The factors that contribute to the progression of HIV to AIDS include HIV infections among both homosexuals and heterosexuals, IDUs, as I've already said, blood donors, non-treatment factors, and proposed studies. So the progression of HIV to AIDS can be attributed to a number of factors. These include HIV diagnosis, age, CD4 T cell count, co-infection with hepatitis B or tuberculosis, person's initial health status, and transmission region. Several studies have demonstrated that the earlier HIV positive patients start antiretroviral therapy treatment, the lower their risk of developing AIDS. This is especially true for those who are co-infected with TB and HPVs. Other factors related to the progression of HIV to AIDS include skin disorders, drug abuse, and several demographic factors such as age and sex. Additionally, research has addressed such issues as how predictors such as transmission categories, years since ART initiation, and other demographic characteristics can affect progression from HIV to AIDS. In conclusion, there are many factors that contribute to the progression of HIV to AIDS, including diagnosis. That is, the earlier you get diagnosed, the better The slower the HIV to AIDS, that means there will be the slow progression of HIV to AIDS because you have been diagnosed early and you're on treatment. And CD40 cell count and co-infections with hepatitis B or tuberculosis. I think I've already said these ones. So what's the benefit of getting diagnosed earlier? Early diagnosis and treatment are important to reduce the risk of HIV progression to AIDS. Treatment strategies such as the ARVs help to control HIV levels in the blood and slow down disease progression. Prevention and management counseling can help individuals manage their HIV infections and prevent transmission. The Center for Disease Control, that is known as CDC, recommends regular testing of all individuals at risk for HIV infection, as well as universal access to preventive measures, treatment, system-level approaches, such as the National Treatment Database and clinical management services in developing countries. Additionally, other factors including gender, marital status, substance use, poverty level, access to health care resources can all affect an individual's chances of being diagnosed with HIV or surviving death following an HIV diagnosis. By taking into account these various factors when considering prevention and treatment strategies for individuals living with HIV/AIDS, we can more effectively manage this epidemic on a global scale. Thank you for listening.
Let's grab hands for our friend. I also have a question.
In what way is skin disorders can lead to the progress of HIV/AIDS?
Skin disorders? Okay. When you say skin disorders, those are like skin diseases. So most skin diseases, like the body is exposed, the body fluids, like there is exposure of body fluids. If you have skin diseases or disorders, so that means you can easily, if someone is having HIV, okay, there chances are high that you can contract HIV from other people because it's like the body fluids are exposed. Sure.
So it's like skin disorders is related with co-infections.
With
co-infections.
Okay, co-infections is like if you have you already have some other diseases in your body. Before having HIV, you already have some other diseases like, for example, okay, let's say TB. You have this is like, let me say TB. So if you have those diseases, and then later on you contract what HIV/AIDS, it's like it finds the body immune system weak, right? Because of those infections you already have. So it is easier for HIV to progress to AIDS because the immune system is already weakened. Sure.
Okay, I also have a question. You talked of non-treatment factors, eh?
Yeah, sure.
So for you've only looked at non-treatment factors, that only.
Okay, I have discussed both. Mm-hmm. I've said non-treatment factors like age, sex ratio, gender. Those are non-treatment factors.
Oh, so that means we have non-treatment factors and have treatment
factors. I think treatment factors.
I didn't hear you mentioning treatment factors. Maybe some of you listened that. I only heard you talking of non-treatment factors. But the moment you started talking of treatment factors, you didn't tell us, eh? So I was confused. We were talking about skin issues. So skin issues, we also treatment factors.
Okay, let me just add that. I've said of non-treatment factors like age, sex, gender. Non-treatment factors I've mentioned of like skin disorders. I've mentioned of co-infections like diseases like TB, yeah, HPVs, yeah. Those are, I think, treatment factors. There is like
They can be treated.
they can be
So,
treated.
okay, I just want to guide on that one. So, our friend has talked about some of the factors that help in the progression of HIV into AIDS in two ways. Treatment factors and treatment factors. I mean, like previously, we only looked at, we didn't categorize them, right?
Yeah.
But this time around, we see that they have been categorized into two ways. So, let us give him a clap. Thank you for the presentation. I don't know.
Morning class.
Don't disturb us.
Okay, my name is Adenule Momnima and I'll talk of the factors which are found to be the ones to contribute to the progression of HIV to AIDS. I'll start with lack of early access to ARVs therapy. What we mean is, when a person is diagnosed with HIV, he or she is put on the antiretroviral therapy treatment so that those drugs can be able to help him to reduce that thing to cause HIV. So which means that when he doesn't have an access to those drugs, this will give chance for the HIV to weaken the immune system, as causing the progression of HIV to AIDS. The other one is drug abuse. The long use of drugs may make the person's immune system to become weak. In this way, to also make the progression of HIV to AIDS and other infections. Another thing which can make the progression of HIV to AIDS is prostitution. Here, when a person who is HIV positive and then goes around sleeping with people again who are HIV positive again, which means that this thing will make those HIV cells to be more in his body, thereby making it easier for the progression of HIV to AIDS. For example, some people, they might have HIV positive, maybe one, and then maybe that particular person goes on to sleep with a prostitute who is HIV positive too, which means that the multiplication of those cells will be able to increase, thereby causing the progression of HIV to AIDS. And then another one is the worries, or maybe I can say stress. When a person is diagnosed with HIV and then that particular person maybe worries so much that maybe is found with that particular disease, which means that that particular person will be able to not to take into consideration of maybe being involved in the antiretroviral therapy, which means that since he's worried, he might not be able to take the steps to maybe of being or maybe on the antiretroviral therapy treatment, taking it maybe serious. In this way, that particular person will be able to make the progression of HIV AIDS increase. Then finally, it's the one which my friend said, the availability of other diseases in a person's body. These ones also make the immune system not be able to fight, thereby making again the person or the progress of HIV to AIDS. That's all I had.
Let's give it a clap. Questions, comments?
Yeah, before you go, how does drug abuse affect the immune system?
Okay, what we mean is, okay, drug abuse is more about a person using the drugs in a way which is not proper. So which means that that particular person, when he is using the drugs which are not in a proper way, which means those drugs will be able to affect him. In that way, maybe weakening the immune system to become weak, hence the risk for the infection.
Thank you.
Yeah.
Okay.
Okay, what I mean is, okay, let me give an example. a person is HIV positive and then he goes around to sleep again and do with prostitutes. So which means that if he might be able to meet a prostitute who is also HIV positive, since we're different, some people are HIV positive 1, others are HIV positive 2. So which means that if he can be able to meet a person who is HIV positive 2, and then he is HIV positive 1, this means that the degree of HIV cells in his body will be able to be what? To be more, thereby giving an increase for the diseases. So
do you mean by HIV positive 1 and 2, do you mean someone having HIV and someone having AIDS?
No. No. What I mean is some people are HIV positive 1, others are HIV positive 2.
So it's like a level.
Yeah. Yeah.
It's like malaria.
Yeah, I can say like that.
Interesting. Where did you get that information? Yeah?
Yeah?
Where did you get that information?
Okay.
Huh?
They say what?
Did you because I'm interested at the source of the information, eh? Because when you are looking for information on the internet, you have to be very careful. There is some information which someone just wakes up in the morning and writes that information down. So when you're sourcing your information, especially for academic use, you have to be very careful. Some sources, they are just like bloggers, eh? You just wake up in the morning, you have your mind, your ideas, then you write them down. You are just blogging. Those are your ideas. That's why I'm asking, the information you're saying HIV1, HIV2, are they from reliable sources? Or maybe they're just someone like the way you've done? And if they are coming from reliable sources, have you quoted those reliable sources that I also go and read? Because for me, something, when I was saying I have a question, I wanted to find out about HIV1, HIV2, that's what they say?
Positive.
Positive 1, positive 2. Where do you get this information? I also want to go and find out more about this.
Okay, you know what I can say? Maybe I should.
Where did you get the information?
I should maybe just listen to maybe. Of course, I didn't got it, but I will just listen.
Yeah, I'm interested in the exact source. Eh? We should find out, is it a reliable source or maybe just someone just woke up and talked about HIV1 and HIV2.
Right.
Yeah. Any more questions? So you were not, I was not the only one interested in HIV1 and HIV2, eh?
Okay, the first to do is your treatment. Like someone is supposed to be there, but here is the area, but she's into prostitution. So how is that one an agent of
Transmission.
Yeah. Okay, what I meant here is maybe that particular person is not only treatment. That's what I meant. I was meaning on that particular part only.
So it is more. It has to do mostly with lifestyle, right?
Yeah.
It's true that HIV is transferred into one and two.
I want the source. Maybe we share it later at the end of the class. I'm going to look at the source at the end of the class. Any more questions, comments? Then let us give me a clap. 100%.
Good morning, class.
Good morning.
I'm William Pili, and I'm continuing on the factors that lead to the progression of HIV/AIDS. So the first factor is cultural and religious beliefs. So traditional and cultural beliefs seeks to consultation from traditional healers, which may limit people to adhere to ARV drugs and access to health facilities. So there are some tradition which believes in traditional healers, where they say if you go to hospital you cannot find the treatment of this particular disease. So they would rather prefer to go to a traditional healer rather than to the hospital. So for example, if somebody is infected with a virus, then that virus will continue to progress in his body, since that person believes to get the treatment from the traditional healers, whereas this disease can only be prevented or be controlled by the medical facilities. And we have religion or religious beliefs. Some religious beliefs believe that God is the healer of all diseases. As a result, some religion refuse or refrain their members to go to the hospital for treatment. For example, we have the apostles who wear white gowns. They try to avoid their members to go for treatment in the hospital. Rather, they believe in prayers. Let's say if someone is sick, they will gather together as a community and pray for that person. So if that guy or a person is having HIV and AIDS, it means no matter how much they can pray for the person, but that HIV and AIDS which is in the body will continue to progress. As a result, it will lead to HIV and AIDS. Number 2 is poor access to antiretroviral therapy. People may have poor information on how they will be taking their drugs, as some people may not follow the procedures of taking each drug every day. This may be a result of not following or either attending the counseling therapy fully. For example, if somebody has been diagnosed with HIV, there are some therapy sessions where nurses conduct for them to give them information on how they will be taking care for themselves as they will be given treatment for ARVs. So for example, somebody does not attend those therapy sessions, it means in one way or the other will miss some of the important information on how he or she can be using those ARVs. So for example, because the ARVs are supposed to be taken daily. So if he or she misses those therapies, today he might take the drugs, tomorrow he skips, the other day he skips. As he or she is skipping, it means he is giving the advantages of that virus to progress in his body. Number 3 is lack of early diagnosis and treatment. People who do not know their HIV status, it may be tough for them to know their health status. As a result, once diagnosed with HIV, the treatment will be given while the virus will be in advanced stages. So for example, you don't know your HIV status. Since you were born, you haven't gone to the hospital to test your blood status. So you have been infected. Now you have started experiencing some signs and symptoms of the disease. Now you go to the hospital. The moment you go to the hospital and you have been diagnosed with HIV and AIDS, it might happen that it will be in the advanced stages. Even if you have been given treatment, it means that the virus has already been turned to a disease now. So it means lack of early diagnosis of the treatment of the disease, it might lead to the progression of HIV to AIDS. Number 4 is stress or depression. People may have stress for fear of being discriminated by friends once they know that they are HIV positive. Sometimes you might have stress to say, okay, if, for example, I go to the hospital and my friend knows that I'm HIV positive, he or she may discriminate me because I'm having this virus. So some people may say, okay, I'll make a decision to go to the hospital to collect some ARVs. As they are doing that, they are making that decision, it means that that virus will progress in his or her body. Lastly, lack of knowledge. If a person is not aware of HIV, of their HIV status, and they are infected with the virus, it becomes tough for them to take proper procedures to control the progression of HIV/AIDS. So if you don't have any information or you lack knowledge on how best you can handle the HIV virus when you are found with it, it might be tough for you to take proper procedures on how best you can be helped by the medical personnel. This is all what I got. Is there any question?
Let us give him a clap. Any questions, any comments? Any questions?
By religious belief, do you also include witch doctors?
Yeah, that's what the religious, traditional healers. Yeah. So it means like those guys, if say, for example, somebody is sick and you go to hospital, say that this guy is terribly sick, monomateness in our base. It happens that you find somebody sick and they will tell you, if you believe in traditional healers, you can go. If you believe in prayers, you can go. So, if is there's some push, but they have failed to heal HIV and AIDS. People prefer to go to those traditional healers, thinking that they will get healed. So, as a result, that HIV virus will still more progress in somebody's body because he or she has just a belief, so I'll get healed. Yeah.
I have a comment. I like the presentation. You've brought in my new facts. He has talked of religion and
Traditional beliefs.
religion and traditional beliefs, which we have not talked about so far. So that's an addition of the points of one of the factors that did the progression of HIV and AIDS. Then also he has talked about lack of knowledge, which I didn't hear anyone of us talking about it. So it's an addition. So you can see how, apart from the 5 factors that I gave out to the class during my first presentation, then we can also see within each and every presentation we are able to see new points which we never talked about. So he has talked about the religion thing, he has talked about lack of knowledge, which is very good, adding on to the knowledge which we already have. You can see how class discussions are very important. They add more knowledge and it's very easy for you to understand. Even very easy for you to remember. Did you ever think of lack of knowledge as one of the contributing factors? When we talked about like being negligent for you going to the hospital or not being on ARTs, lack of knowledge also is a very good contributing factor. Because if you don't have knowledge of how your body operates, or maybe like if you have some symptoms, or maybe your lifestyles are not very good, they are risky. They may lead you to get AIDS, because that HIV will keep on multiplying in your body. You have no knowledge that you need to go to the hospital, you need to practice very good healthy lifestyle, maybe doing exercises, or maybe eating nutritive food. Because of that lack of knowledge, it may lead the HIV to progress into AIDS. So it depends on how you defend your point. The way you may have a very good point, but the way you defend that point also matters. Are we together?
Yeah.
Any more comments? Okay, let us give him a clap. The last presentation. You said you are going to present, but you don't have the way. So present.
Yes, accepted this.
Present. Sorry, it was not true.
No.